But if the measure of wearing a mask when you're healthy is simply because of a what if in the future, in particular the upcoming flu season, doesn't that mean we would always be wearing a mask for what if? It makes you wonder, since none of these bylaws have an end date on them. To mask or not to mask? If you're Canadian, you may no longer be able to answer that question for yourself. Why? Because it seems faster than one can say snuffleupagus. Cities across the nation are mandating masks everywhere in public spaces indoors. Unless you're Banff, then it's outdoors too. This new wave of face mandates is mostly being voted into existence by politicians rather than being suggested by the head health experts. Additionally, it is also taking place, a whopping 6 months after Justin Trudeau was made aware of the mysterious virus spreading through Wuhan, and also when Canada's COVID-19 counts don't even reflect a pandemic at all. Let's take Nova Scotia, for example. According to novascotia.ca, just a few days ago, both Premier Stephen McNeil and Dr. Robert Strang, Nova Scotia's chief medical officer, announced that masks will become mandatory in most indoor public spaces starting July 31st. But wait a second. If you look at this article from the Halifax Today, you'll see that this announcement came when the entire province of Nova Scotia had 0 new cases and only 1 active case in the entire province. And mandated masks for everyone with numbers like that? Not only that, there was no individuals at the time in the hospital with COVID-19. Is it really necessary to mandate healthy people all across the province with numbers like that? I'm just asking for a friend, so don't come at me. Other Canadian cities are mandating masks and showing similar lower numbers. Last week, CTV News reported the city of Edmonton is making masks mandatory on public transit and inside city facilities as soon as August 1st. And interestingly enough, Alberta.ca's COVID-19 count up to date as of July 26th only had 17 people in the ICU for the entire province. And these 17 people in the ICU, whom I pray have a speedy recovery, are 17 out of a population of 4.5 million. To put that number in perspective, the Calgary Herald reported that back in May, Alberta's chief medical officer, Dr. Dina Hinshaw, estimated that more than 800 Albertans could be hospitalized with COVID-19 at the likely peak of the province's coronavirus outbreak in mid-May. Also, that at the outbreak's peak, 232 of the 818 admitted would likely be in the ICU. Thankfully, Alberta is a long way away from such predicted numbers. Now, Calgary also jumped on the must-be masked bandwagon. A few days ago, CBC reported that the City Council voted 12-3 in favor of the new bylaw, with Councillors Sean Chu, Jeremy Farkas, and Joe Magloka, hopefully I said that name right, they voted against it. The bylaw outlines a mandate for those age 3 and up, toddlers included, unless qualified for a few exemptions. You would have to wear a face covering over your mouth, your nose, and your chin, and it would apply to all indoor public spaces in the city like malls, grocery stores, and on Calgary Transit. So what are the reasons for these mandates, since the small COVID counts don't seem to align with the new laws? One reason Calgary's Mayor Naheed Nenshi gives, according to the CBC, is because we need to take bold action now if we want schools to reopen, if we want kids to feel safe, if we don't want to close the economy again. It's interesting that Mayor Nenshi uses emotion-driven words like want and feel rather than data and science when discussing things like what measures should be considered regarding our children heading back to school. It's quite a different stance than Toronto's Children's Hospital for Sick has taken regarding kids returning to school. The hospital's detailed report found on sickkids.ca not only recommends that our children return to school, but it lists several reasons why, when they do, masks are not recommended for our children. Another driving force into the spreading of Canadian mask mandates appears to be the pressure citizens are putting on politicians and other citizens through organized petitions and even incentives. A website called maskformunicipality.ca reminds citizens communities can call for masks to be mandated and says they will be giving awards to people in local government, health professionals, and community members who have shown leadership on masks. Leadership on masks? Rewards for doing so? Sign me up. Maybe, maybe not. This is all a very interesting thing. It's quite a bit of effort going into removing someone's rights to choose, just to choose. It's also common to find petitions like this one calling on the mayor of Edmonton to immediately mandate masks. The petition states that July 20th, there were 141 new cases in Alberta, and then quotes that the economist Andrew Leach wrote, if active cases growth in Alberta proceeds at the same daily rate as it has for the last 2 weeks through September 1st, we'll have 13,600 active cases by the time kids are heading back to school, and we'll be adding 1,000 cases per day after Labor Day. Except that big if Andrew Leach mentioned didn't happen. According to CTV, Alberta did sadly report 8 COVID-related deaths happened over this past weekend, but an even closer look at the statistics outlined by Alberta's chief medical officer showed that there was also a steady decline in the new cases, stating that after more than 28,000 tests, the province added 110 cases Friday, 103 Saturday, and 91 Sunday, meaning each weekend day was less than the July 20th date mentioned in the petition, with the Sunday being 50 less cases in a day. Now, 5 of the most recent deaths were linked to an outbreak at the Good Samaritan Southgate Care Centre in Edmonton. 4 women in their 90s and 1 in their 80s. In all, 12 residents of that facility died. And that's horrible. As of Monday, there were 47 active cases among residents and 14 among the staff. Another 8 staff members have recovered from the illness. I feel like I asked a lot of questions in this video, and I think I'm going to end with some more that you can express your own input on in the comments. Now, I don't usually reply, but I do take time to read and hit a like on the comments. And one of my questions is, if the new norm is for healthy people to wear a mask, not because we're at the beginning of the spread of an unknown virus, or that we're at the peak of a virus we've already been experiencing for months, but if the measure of wearing a mask when you're healthy is simply because of a what if in the future, in particular the upcoming flu season, doesn't that mean we would always be wearing a mask for what if? It makes you wonder, since none of these bylaws have an end date on them. Or are we supposed to wear masks until there is a 0 COVID case count? As you can see by Nova Scotia, 1 active case in the province is enough to mandate masks on healthy people and take their right to choose away from them. I'm Drea Humphrey for Rebel News. Wondering if you legally qualify for any mask exemptions, and if so, how to clearly communicate those exemptions when doing simple things like grocery shopping? Well, if so, you want to make sure you head to maskexemption.ca. See, that's where you can buy your wallet size card or print it, and you can also donate to Rebel to cover the cost of making the cards.